Ebola Preparedness. 1 minute can save your life.
Good morning. I'm Dr. Denard Fobbs, Fresno, California. I'm representing Save Africa, Save Our World. And I'm in the office of Dr. Terry Gillian of the Fresno Aesthetic Institute for Plastic Surgery. We're going to take a moment to illustrate lessons that I learned and lessons learned in the Democratic Republic of Congo, specifically at Bongo Hospital, where I worked a little over a year ago with Dr. Jean-Claude Battanini, and we had the opportunity to go through some steps of what's done differently in the Congo in dealing with potential infections with gloves, hands, gowns, with patients who might have Ebola, and how the differences in managing those aspects of surgical and patient interaction can help prevent self-contamination and infection with Ebola. So what we want to do is take their experience, which over 35 years has included hundreds of patients with Ebola and little to no infections involving the healthcare personnel. Actually, only one healthcare personnel has been infected over the past 30 years, and use those techniques to foster a greater degree of safety in what we do going forward in America and the rest of the Western world. Next, we're going to illustrate and give an example of how we can apply these principles of decontamination and infection avoidance from the Congo to using our hands, gowns, and gloves in a typical environment, surgical environment, or infected environment in America. We're going to be using, as Dr. Sanjay Gupta did a few days ago on CNN, chocolate sauce as an illustration of grossly contaminated gloves and how they can be removed and how you can go forward from removal without any risk of significance and any risk of contamination. We're going to illustrate now how to handle hands and gloves in a way that's similar to that in the Congo, which should limit the likelihood of contamination and self-contamination dramatically by using these techniques learned from the Congo, period. Yeah. Okay, as did Dr. Gupta, I'm using chocolate sauce in my hand to act as an example of what gross contamination looks like, a little bit on the front. And so I'm going to show you some things that are done in the Congo, which we never do. Some of them we will not do in the future, but they're going to give an illustration of how these things can be done differently and potentially save lives and reduce the risk of contamination dramatically. This bucket over here contains an example of a chlorine solution, a bleach solution, that's used for rinsing gloves in the Congo. In the Congo, gloves are often reused because of lack of resources. So this is a step, very uncommon and not thought about in America, that's going to be a very interesting piece of how infection is avoided. So I'm going to dip my hands and wash this in the bleach solution. Go. Okay, after doing any kind of procedure or significant patient contact in the Congo, you would rinse your gloves in a bleach solution, which Ebola has been shown to be astonishingly sensitive to bleach and suffer immediate death. So that means that right after doing that, the gloves are already relatively safe. So now we're going to proceed to taking off the gown and gloves and show how this is managed and how infection and contamination is further avoided. Just push it there and then we hold.
Oh, okay. Start.
Okay, now we've already pre-decontaminated the gloves in the bleach solution. So now we're going to disrobe, and Dr. Gillian is going to help me with that. One of the things that I think is very helpful from the way things are done in the Congo is that seldom does the doctor or the person taking care of this this contact with an infected person, such as someone with Ebola, seldom do they do everything by themselves. They usually have help. So Dr. Gillian is going to help me take this off, and it's going to prevent it's going to prevent us having straining and flinging of material. So it's going to be done more carefully. And the gloves may or may not come off with the gown. It doesn't really matter. In this case, they're not coming off. And that's okay, because we want to illustrate how this is done. And what I illustrate is going to be very similar to what happened with Dr. Gupta. The difference is already Dr. Gupta's gloves were still grossly contaminated. Mine are not. So I'm going to take this off. And it's going to go over here. Then I'm going to have to use my finger, my hand, and I'm going to have to take this off. Now, there is still a possibility of contamination. And if one doesn't recognize this, this is where you have a problem. So Dr. Gillian is going to now use an alcohol solution, or it could be a dilute bleach solution for me to do another layer of decontamination. Okay, that's great. So what I'm going to do is this is spread all up into the area where the gown and the gloves were. So now I've done another layer of decontamination, and these hands are in perfect condition. And so this is a step that gives you the safety to not have to worry at all about potentially self-contamination with Ebola. If you had on a shield or a mask or a heavy-duty mask like Dr. Sanjay Gupta did, that could be taken off now. It could be taken off before. And then whenever that's done, you still want to proceed to a hand wash, so that the last thing you do is make sure that the hands were done and that you don't walk out of any situation with anything other than perfectly clean hands.